The orbitozygomatic approach. Lesions located in the ventral midbrain or the pontomesencephalic junction can be approached using the orbitozygomatic craniotomy. This craniotomy can be performed in one or two pieces, and it may be performed as either a modified orbitozygomatic or a full orbitozygomatic approach. Removal of the terional as well as the orbitozygomatic units allows for exposure of the frontotemporal regions, giving the surgeon both a subfrontal and subtemporal access to the posterior fossa contents that may be necessary to approach lesions in the brainstem. After splitting the sylvian fissure widely and releasing spinal fluid from the basal cisterns, the surgeon arrives upon the membrane of Lilliquist. Opening this membrane provides an excellent view into the posterior fossa. This can be used to approach the midbrain and upper brainstem structures. Two safe entry zones for lesions located in the midbrain have been described. The first one is known as the anterior mesencephalic zone, or perioculomotor safe entry zone. This safe entry zone is aligned to run parallel to the orientation of the corticospinal tract, which resides in the medial 3/5 of the cerebral peduncle. The anterior mesencephalic safe entry zone is located between the posterior cerebral artery and superior cerebellar artery, just lateral to the third nerve. Alternatively, an interpeduncular safe entry zone can be used. This approach is ideal for lesions located in the centromedian midbrain and makes use of the relatively sparse fiber density located in the midline of the midbrain. The interpeduncular safe entry zone is generally approached using the contralateral orbitozygomatic approach and dissection between the basilar perforators, mobilizing them and placing a small opening into the brainstem in between these perforators, which allows the surgeon access into the centromedian portion of the midbrain. This axial section describes the relative orientation of the various critical tracts, as well as the anterior mesencephalic and interpeduncular safe entry zones, and how they may be used to remove lesions from the midbrain. While a relatively large opening, the deep portion of the orbitozygomatic craniotomy provides access critically to this upper portion of the midbrain in a way which other areas cannot, and, if done correctly, can be performed with relatively little morbidity.